had a summer, but we've all been a bit away or done something, I presume, for August. So anyway, welcome to the first meetings back in September. Lindsay, apologies for absence.
Yes, we received apologies from Councillor Lees and Councillor Bayton, and we are currently not quorate.
Joy. Okay. Colleagues, you have received extensive papers for this meeting. Do we have any declarations of interest to make? Okay. No. Okay. Can we take the minutes of the previous meeting? Firstly, for accuracy, page 1, page 2, page 3, page 4. Record.
Yeah.
Thank you very much, colleagues. I will take silence as agreement, I think. And okay, in terms of the matters arising, the action tracker is on the agenda, and all other actions have been completed that are set out on page 7. Okay, can we now move? So we're now on item 4, Chair's remarks. I think this possibly we will pick up in more detail under Julia's item on item 6. Members will recollect that at the last meeting when we discussed the economic recovery, we had our usual, what feels our usual concerns about how real and how relevant some of the proposals were, and indeed, you know, what criteria had been applied to the selection of these proposals, and when were they going to happen, and what was the delivery. We agreed that we do a number of deep dives, and I'm slightly lost to remember now how or why, but I think we picked the Gigafactory and the Diagnostic Hub, which is on today's, partly because they'd received quite a lot of sort of PR and press coverage. And again, what we wanted to do was to understand how that was going to impact upon our region. We have met and discussed with officers the Gigafactory, and we did ask for it to come to this meeting. But the issue was that in many ways the questions we wished to have put weren't actually able to be answered. I think what I would say is, and you will see from your note, my colleagues in Coventry have done a fantastic job in terms of setting out what Coventry's perspective is and where they see how it fits into a national position. What we're very keen to understand is actually what does that mean for the skills profile for our region? What are we now doing to skills to actually start to make us ready if the Gigafactory comes through? A very simple question we had was, where's it going? Where's the plot? We weren't able to get an answer to that. We were also really keen on, and your note, you will see from your note that there was a comment about 105,000 jobs nationally in the automotive industry, 50,000 of which are located in the West Midlands, and that this Gigafactory would protect those. I've written enough headline bids to know that we can talk things up. I think the job of Scrutiny is to understand, of those 50,000 jobs in the West Midlands, what is the contribution of the Gigafactory? What is the supply chain? And what are we doing now to protect those jobs? Because actually, by the time a Gigafactory is built, we could well have seen many of those supply chain jobs going. So I think what Patty and I felt was that we were asking for a significantly more substantial piece of work than could be just done on the hoof, but really very much trying to understand that the big and shiny projects projects that we're also keen to send press releases out on actually have to have substance in the what they're going to do for our economic base, and actually being able to answer those questions are really important for the credibility of democracy in our region. Stephen, you have a point.
Yeah.
Councillor Stephen Simpkins.
Yeah. Association Black Country Councillors. The problem that I find that we cannot really get answered is what's the value for money for these projects? We're talking about protectionism with regards to jobs. Well, the market don't work that way because it's a laissez-faire market. So protectionism can be built in by policy. And as you see, policy is lacking for me across the whole of the combined authority. We're still not getting quoracy scrutiny meetings, and we're still not getting governance scrutiny panel together with regards to that. But these large projects never have value for money, and there's no study paid to that. And that's what really concerns me.
Okay. Stephen, maybe we can pick this up further under item 6, but I would say I concur with much of what you said. And again, one of the issues, it's a little bit about the same with the zero carbon future. Actually, what we need to do is act now and deliver now. One of the things that when I read through the recovery plans, I want to know what's it going to do for the SMEs on the Soho Road, the ones in Smethwick. How are we going to actually help those businesses understand they have a future? Just because you referenced it, I have expressed concerns also to officers about us progressing the governance review, because we clearly undertook the review. We did undertake it in a slightly different time. We undertook the governance review when we thought there would have been a mayoral election, and that scrutiny review was going to serve as a briefing for the mayor, whoever took up office in the new municipal year. Clearly no election happened. We have agreed with officers that the governance report needs to be participated with this committee, and I'm due to pick up with Tim Martin about that afterwards, because again, where I have really deep concerns is the accountability of some of these boards. There is a power of incumbency in this region that we really need to openly and transparently address, because it is not actually giving confidence to a range of businesses that actually their interests are being put forward. Deborah.
Thank you, Chair. In terms of the governance review, I think it's quite right that Overview and Scrutiny have the opportunity to review that. But I would also just point you to the white paper discussions that are being had as well about the powers for a combined authority. And you need to take the two hand in hand, I would suggest.
Yeah.
I think the other important thing for this committee to also acknowledge is where are the decisions actually made. And as part of the governance review, I think for you to pose that question, I think would be really helpful. The reality is the important decisions that are made that relate to resources and policy agreement are made at the board, and that's within the Constitution. However, your challenge is are some of those decisions. Do people feel and think some of those decisions are being made on the various boards that we've got? I think that's the issue for this committee to explore.
It is, and I think again what came through the governance review, and you know, I think I've been around bureaucracies long enough to know, and you know that I will know that by the time a paper gets to the board, it has gone through more than several iterations. Various projects will have been rejected, various things will have changed. And what I think is really important with a strategic body like the Combined Authority, we understand at each point of the sort of decision-making train where those decisions are taken and what is taken.
Right.
I'm going to take the two colleagues who've got their hands up. I've just done something strange to my computer, which I think is Stephen coming back. And I don't know who else.
Deborah's still got her hand up.
Yeah, Deborah's still got her hand up. Okay, Stephen.
Thanks, Chair. I mean, there is a possibility that with the next round of devolution that's about to become us, we could change the governance procedure, make representation back to government and get it more accountable. Who actually scrutinises the board? We never get pre-decision stuff come. We've got big ticket items and coming to amounts of billions of pounds for the West Midlands, and it's unaccountable. That's the way that I feel. I've been on here for over 4 years. And for 4 years, we've been saying about accountability. There's an opportunity now with the devolution paper that's coming forward for us to change the governance structure. It doesn't work. It's not working. How many times have we been quorate? I'm passionate about what we're doing in the combined authority, but this is public money that's being invested across the West Midlands that's unaccountable. That's unacceptable. My earlier question was value for money for the projects. When do we ever get sight of that? We never. And there's lots of, there's 6 pieces of legislation that the mayor controls, and there's lots of stuff that the mayor does that's outside of his brief. We're gonna have the Giga Hub soon. That's public health. That's health. That's outside the mayor's remit.
Yeah. Okay. Stephen,
Sorry.
that's on the agenda.
I know, but that's an example.
Well, it's partly why it's on the agenda, to be honest. Can I ask Julia to pick up on the value for money issue on item 6, because my reading of the papers is it's one of the criteria that was applied. So I would hope in terms of the economic recovery plan she'll be able to answer that question. Is Sean with us yet?
Yes, we have Sean.
I am, Ma'am. I am very, very sorry I was late.
You're marming me again, Sean.
Sorry, Chair.
Okay. Okay, colleagues. So we're now on to item 5, the Recharge West Midlands Creating Grand Central Diagnostic Hub. Sean, we're very grateful for the presentation you've provided for us, which I trust members have read. I'm happy for you to skim through this. What I think the key questions for scrutiny is why the diagnostic hub? How does that fit with the priorities for Recharge West Midlands? How real is it? And if it's to balance up the regional inequalities in health, how's it going to do that, given most of our poorest deprived communities don't go near Grand Central? So again, I think what we're trying to do, the reason is why the investment and emphasis on a direct health thing, and how does this truly fit with the economic recovery? But I'll let you go through your presentation briefly, and then I've got questions already from Councillor Chalk. Unless Michael, are you wanting to ask a question now, or?
Yes, please. I was just wondering. I have a problem that I can't get the agenda and other papers on screens at the same time. And I do know I've had somewhere from Tanya, I believe, a breakdown or quite a long report on the Gigafactory, and we seem to have bypassed all that information.
Yeah, the report on the Gigafactory hasn't come. So well,
I've got it from somewhere then. Somebody sent me a huge pile about paperwork about it and the number of jobs it's going to save and all that sort of stuff. And I've read it.
Lindsay, do you want to?
Yes. So what members would have received was a summary note, which Councillor Trickett referred to under Chair's remarks.
Right. Okay.
And yeah, the committee will receive a more detailed report at their meeting on the 2nd of November.
Okay, I'm losing the plot.
So it's such a big item. I thought we could deal with it more.
Okay, yes, it is, and that's absolutely why it's coming back on the 2nd, because it needs some greater attention. I think. Sean, you're going to share your presentation on screen, I'm assuming?
Yes, Chair.
Okay. Lindsay, is it possible to put in the chat column the agenda so members can, the papers, so members can always pick up on it in the chat column as well?
It is. So Dan posted the papers in the chat column at 9:22 this morning.
Okay.
So members should be able to access the presentation on there too.
Do you want to advise members how they can find the chat column, just so that we don't?
Yes, Chair, sorry. So nearer to the bottom of your screen, if you hover your mouse, you should have a number of options come up, and to the right of the hand symbol, there should be a little text box, and if you click on there, it should bring up meeting chat.
Yeah, okay, that's, I think this might be where some of us don't have that facility on these, but we do in, I think you will find it's underneath. I'll have a look for it whilst, okay, can we move on to the presentation? Sure.
Chair, thank you very much for that. I'll just, hopefully you can see my screen in slideshow.
Yeah.
Can you see that okay, Chair?
Yeah, that's great. Thank you very
Lovely,
much.
thank you. So I'll run through it really quickly because you all hopefully have seen it beforehand. But the reason we're here is because back in February this year, we had a conversation with University Hospital Birmingham and a number of other partners around the implications for health inequalities across the region. And we've been working on the health inequalities impact for probably about the last 14 months through the Wellbeing Board, and recognise that the health impact for the region is very, very significant. And what we've now had is actually post this event, we've had COVID, which has created a really significant amount of inertia in the health system for a whole host of issues, including the diagnostic and treatment of various referrals and cancer treatments. So what we've seen there is that the system, which is the NHS system, has seen a 60% reduction in referrals for cancer and diagnosis and a 20% drop in patients seeking treatment. The investment, therefore, for this, is for context, was about just short of £13 million over 3 years, and it was to initially start us off with a thinking position around Grand Central Station, and then 2 further wave pilots should it be successful, which would also link into a wider radical health prevention fund, which was £10 million, which again is supported. Now, to put it into context of where we are now, we've just been undertaking what we call a radical health impact of COVID, which is a piece of work that's been done on behalf of the Combined Authority, working with a number of partners across the Task and Finish group. And that interim report was published about 2.5 weeks ago now. And we've put out a call to evidence to the general public and to the system to try and understand where we are and where the implications are around the COVID impact of health. But also we are very thoughtful around the broader health inequalities for the region, which are, again, I've described as being stark. So what we want is that we want a healthier, happier, better connected, more prosperous West Midlands. But we quite often forget that the health impact of looking into the economy, and we see that health and wealth are 2 sides of the same coin. So illness cost amongst working population £100 billion a year nationally. We know that about 330,000 people become unemployed each year because of health-related issues. And every unemployed person into work who goes into work has a saving to society of £12,000 in the first year. And I could run through that to go for further stats. But we also recognise that the carbon footprint of people moving about to get to hospital appointments is actually taking between 4 and 5% of the country's carbon footprint. And we do know that air pollution is linked to 36,000 deaths annually from heart disease, stroke and lung cancer. That's unexpected deaths that we can do without. So why the West Midlands? Well, the West Midlands is the beating heart of the UK, and we recognise that actually that we have below all England average health outcomes for our region. We've been working through the Wellbeing Board for a significant amount of time now on a Health of the Region report, which started off around a Marmot Nation type of approach, a Marmot region, to try and understand actually how are we going to start to use the influence of the Combined Authority to really drive health impact and health improvement. And what we were thinking about actually through this proposal was actually broader links to innovation, which is including the Birmingham Health Life Science Park, supply chain manufacture, and starting to think about the 5G and digital tech world that is going on in the West Midlands. So linking it to the strategy for the NHS, so we know that Diagnostic Hubs is thinking about distributed offsite model. So we're now talking about distributed healthcare, not necessarily just in the acute care setting. How can that be put into an area which is better suited to the population? How can we use digitally enabled services to really transform the services that we're delivering, whether that's through artificial intelligence, through signposting, creating real difference now? And actually, how do we develop and build a stronger workforce in local communities? So what we want to try and do is try alone by delivering different distributed healthcare models means that we can free up to 500,000 appointments across by joining up the system. So 500,000 appointments a year across Birmingham and Solihull, because actually what we're now doing is having a smarter way of working with the NHS system, with getting people back to local places. So why the High Street? High Street? Well, we've talked about Grand Central being one venue, but we recognise that high volume footfall venues will still be relevant post-COVID. And from the original meeting of pre-scrutiny to being here today, I've reasserted that with both the transport network and the shopping network, as well as the hospital states, to say actually their view is actually post-COVID, whenever all of this starts to calm down, that actually we will start to get the numbers back to where we were before. That is the hope, and that's where we want to be. We know that transport infrastructure will remain in place and is still providing access. And actually, as I said earlier, the future of healthcare is distributive, and revitalising the high street with healthcare is a positive opportunity and will really drive some of that activity for our local people to access local healthcare. So what we wanted to do is to use this position to have one big programme at Grand Central, and then to think about two smaller programmes around a test and learn approach, Black Country or in the Coventry Solihull patch, linked to the need and footfall. So recognising that not everybody travels into Birmingham, recognising that not everybody will go into Grand Central, but actually how do you get local people to local areas to get the nature of support that they can possibly get? So we've started to have conversations with delivery partners, so University Hospital Birmingham, Birmingham and Solihull STP, University of Birmingham, the Academic Health Science Network, so we can actually make sure that we are getting value for money and putting some academic rigour behind all of this. The Black Country and Warwickshire and Coventry and Warwickshire STPs. We've had some early discussions with TFWM and Combined Authority. Nothing is set in stone for other sites, but really the Grand Central is our one big programme to start off with, to see where it goes out going forward. And then the Grand Central Hub has been engaged already. So what does that look like? Well, actually, revenue cost to run it is about 8.75 million over the 3-year period, with capital investment of 4.2 million. And that will put into the various venues ophthalmology screening, echocardiograms, for monitoring opportunities, an MRI scanner to get people access speedily, CT scanners, X-rays and mammography kits. So what the whole intention here is to try and enable people to have a choice of venue to go for their diagnostic examination at a place that is close to them, actually, where they are when they're popping into the city or they're popping into work, and actually doing that in that space. So they're having one journey instead of having to take time off work and then go out and do it at a various venue. And then that will hopefully make it smarter and more effective. I'll leave it there if that's okay, because I'm sure there's going to be lots of questions.
Okay. Thank you for that, Sean. And again, it's a challenge for scrutiny, isn't it? Because it is not our job, the question, to dislike the policy. It is our job to understand if it is an appropriate use of resources, if it fits the sort of criteria and the overall strategic direction. Unfortunately, Kathy's not been able to be here today because she's having to take Councillor Kathy Baton, Councillor Grinsell, is not able to be here because she's having to take her mum to hospital. But, clearly her mum wouldn't travel into Grand Central because they don't actually have a metro link from Dudley. What I would say is we constantly don't learn the lessons of the past. And one thing I found a really deep lesson during COVID, because the organisation I chair ran the food relief operation in Birmingham, was how actually public services just aren't in touch with the local networks, that people do have a total informal set of local networks. And in many ways, if you looked at the profile of our city and where we know say in Birmingham, you are more likely to die early if you come from East Birmingham than if you come from North Birmingham, Sutton Coldfield way. You'd be far better putting a diagnostic hub into Primark than you would be to put it into Grand Central. And I keep on coming back to, I get the beauty of the diagnostic hub, and it'd be great for people like me who work in the city centre. Where I get confused with all of this is, why is it being, if it's about actually bringing the workforce and keeping the workforce fit, then let's say it's about keeping the workforce fit, and that's what it's about. If it's about addressing inequality, then I can't see how your proposal meets that objective. And this is what this is the problem I think we have with this one, is what is the objective? Can I invite my colleagues to come in, and then for you and Deb to come back? So if I start with Ahmed, then Richard, then Stephen.
Good morning, Chair and colleagues. Councillor Ahmed Boston, Sandwell Council. My real concern that I have is further to the point that you've made, Chair, is around accessibility of this facility. I know that certainly when you look at Grand Central, it's always the glossy, glitzy part of, of Birmingham and part of the West Midlands. But I wonder whether any assessment has been done as to the amount of people actually from inner city communities, whether that's inner city communities and inner town communities within the Black Country and Birmingham, that are actually travelling to Grand Central and have interaction with that facility. And secondly, whether any work has been done around the Black, Asian and minority ethnic communities that have been suffering from health inequalities for a long time, that have only been exacerbated because of the coronavirus pandemic. So those are my two questions. Thank you, Chair.
Thank you, Ahmed. And yeah, it's quite expensive to eat in Grand Central. Richard Brown.
Thanks, Chair.
Councillor Richard Brown, sorry.
Yeah, I've got just a couple of questions around this. It talks about on your slides a reduction in referrals of 60%. And I'm making an assumption here, and this is probably dangerous, but those would come from GPs. And I'm struggling to understand how this proposal is going to address that, because if people are not going to their GP and therefore we're not getting the referrals via the GP, why are they going to go to Grand Central Station and get a referral? If they're scared to go to the GP, and I understand I'm making assumptions here, then they're just going to be as scared to go to Grand Central Station. And I agree with you, Chair. I don't think we're going to be hitting the right people here. So that was sort of one question. The other thing is, sorry, it's a minor point really, but when we're looking through all these slides, and there's one on your delivery partners, and he talks about UHB, BSOL, STP, UOB, WMA, Black. It takes me ages to understand what they are. And so if you're going to do stuff like that, just make sure that either there's a key which helps explain it, because it's bad enough having to wade through these papers anyway without trying to understand what all these things mean. And the final point is, I don't see here anywhere that sort of profiles who we think is going to use this. What is the typical profile of the person that we're targeting at? And as a return for the investment that we're making, how many people do we think are going to take this up? So have we got some sort of targeted numbers that I can sort of go back to people and say, well, for this 13 million quid, we expect X number of people to take this offer up. I don't see that anywhere, and I would like to know what that target number is. Thank you, Chair.
Okay, thank you. And finally, Stephen, before I come back to Deborah and Sean.
Well, the first thing is I'd like to understand if you've contacted all the local wellbeing boards from each 7 Mets outside the Mets, because we have a partnership with the Shires, and what their steer was with regards to this. Also, health scrutiny in each authority. What's the contribution that's been given to them? They're part of the solution. The simple matter of the fact is there's a lack of GPs. If we'd got more GPs, you'd get more referrals. And the drop-off of referrals is because of the COVID situation we find ourselves in. You cannot get a face-to-face appointment with doctors. It's over the phone. So, you know, if you want to benefit the health, you need to look at the key factors, which is ill education, poor diet, poor life expectancy, poor housing. We'd be better off spending 13 million quid on just purely training up more doctors for the future, more nurses. We've got situations where building on hospitals have stopped, the big one in Birmingham and Smethwick. We in Wolverhampton, we have got a hospital, New Cross, that does referrals into Cannock. Now, if you tell me, if you're a 90-year-old woman who's got a referral from where I live in Bradley to Cannock, right, how does she get there and what's the affordability? It's not going to work. We need to have more GPs, more doctors, more nurses, more specialist centres in communities, not at Grand Central, big shiny new projects. I mean, it begs the question, if you're going to put this hub into the Grand Central, what are you going to do if we don't put it there? There's nothing in Grand Central other than the youth hub. For me, there also is the accountability and the value for money. Where's the value for money? How will it demonstrate health benefits? I can't see that. I cannot see it, and I've struggled to find out who comes up with these ideas. And like I said earlier at the beginning of the meeting, health and well-being is purely the responsibility of each local authority, not the combined authority. It's out of the remit. You know, why are we spending public money or bidding for public money outside the remit of what the combined authority should be doing? Shouldn't it be building better houses and more affordable houses to address health issues? Shouldn't it be encouraging skills and learning? That's the best use of the resource. This is just a grandiose. Oh no! How much does it cost to set all this up? To do this report? Unbelievable.
Okay. So thank you for that, Stephen. So Deb, I don't know if you want to come first, or Sean. How do we actually ensure we are, who's this for? How can we actually get to the people who actually need such testing? How's this addressing inequality? Where's the accessibility? Where's the engagement with the wellbeing boards? Where's the VFM and real benefits? Deb, do you want to go, or Sean?
Yeah, if you don't mind, if I try and give some of the context to this, and then if I can hand over you to address some of the more specific issues. So, Councillor Simpkins, I share your concern about putting tanks on lawn and are we overstepping our remit by doing some of this work. What I would say is part of the responsibility or powers for the combined authority when we were set up 4 years ago was around public service reform. And it's also about servicing the regional health and wellbeing board as well. So you could argue there is some legitimacy in us exploring this kind of work that we're doing at the moment. But there's there are two more driving forces for why we would want to do that. One is around innovation and capturing more R&D into the region, and this I think is a project that has been subject to national kind of scrutiny around bringing in more R&D resources into the region, supporting the kind of workforce development, research, etc., into health, working in partnership with our health partners. And I'm just trying to give you a justification and some of the context. Now, our driving force for this is that this is a pilot linked to the 5G programme that we've got. Now, none of this diagnostic work can take place without adequate 5G. You can't run an MRI scan that then puts the results back into the hospitals without 5G network. So it's all connected into our 5G work that we're doing as well. And what I would say to you is this is simply a pilot to see whether this works. Now, we know that the need for this diagnostic work rests within some of our more deprived communities. And Councillor Boston, you're absolutely right. If you look at our communities that are most deprived, you will see that the rates of take up for screening is pitifully low. And we know that Black women in particular are those that are less likely to access screening. That's the reason why we've got higher instances of cancer, of perinatal mortality, because women don't access prenatal and postnatal care in those deprived communities. Now, that is not good enough. That also means that there is a workforce, potential workforce, that we are not supporting to allow them to access the jobs and contribute to economic growth. Now I don't see this project as being the only project that we deliver of this type. This is a pilot to make sure that it works, and we then roll out into our high streets. Now, one of the things that I think Overview and Scrutiny should be calling for is, are we joining up the dots adequately? So we have a whole programme of high streets and town centre renewal. Are we ensuring that part of that work also asks the question about how we redesign and repurpose our high streets? Should there be, for example, an automatic assessment of the likelihood of a location for one of these local screening resources? Now, in my view, on the Borsley Green Road, that should be the first place where we say we expect to have local screening facilities for that particular community, because that is one of the areas where Black women do not access health screening services. And that is one of the areas that has the highest incidence of perinatal mortality. And it's not good enough. Now, we can't automatically have a whole programme of these local screening facilities until we've tested it, until the health service is prepared to work with us and see this as a legitimate way of getting services to those communities that need it most. So I think as an Overview and Scrutiny Committee, you should be asking those key questions, as well as, of course, asking those broader questions about, do we have enough GPs with the right skills that are accessible to our communities? Of course, you should be asking those questions, but you should see this project as a project that could lead to much better provision for our communities. And I just wanted the committee to appreciate this, that for us, this isn't the only project that we want to see across this region, but we've got to test it, we've got to pilot it, and we've got to make sure it works and it is accessible. So, okay. Sean, I don't know whether, Chair, if you now want Sean to address some of the specifics.
Can I bring in Councillor Mike Chalk and Councillor Peter Fowler, and then Sean, if you can wrap up on the specifics so we can then move on to item 6. So Peter and Michael. Peter first. Councillor Peter Fowler.
Shall I go first, Chair?
I did suggest Councillor Peter Fowler, but Michael, if you're eager and ready, then fire away.
I'll go on move.
Peter?
Yes, thank you, Chair. Yes, I've listened in intently to a lot of the questions and comments that have been made. My first thought was that I've seen that, sort of the rundown and bullet points, if I want to call them those. But one thing I was surprised that we didn't get was an in-depth report. When the Stevens referred to, Councillor Simpkins has referred to a number of things, but I'm just thinking, well, where's the kind of in-depth reports? Where is the benefits, etc., etc.? I see it talks about the Grand Central Station, and then I see about future pilot hub sites, which I put question mark. Haven't got a clue where they are. My other points were the Black Country, Coventry and Warwickshire, and other STPs. I don't even know what the thoughts are, perhaps via Councillor Izzy Seckham, who is the Chair of Health. And as we are an overview and scrutiny committee, I always thought that when, like to Birmingham City Council, the Health and Wellbeing Board have various reports, and then we come over, as I sit on the overview and scrutiny committee there, that therefore we then scrutinise. So I don't know whether I've got it wrongly. So it also looks a little bit like cart before horse on this. Where is the report? Where is the comments from health and well-being? But I certainly agree with what Deborah said about the public service reform and certainly about partnership working. Councillor Ahmed mentioned about the communities and the effects on the ethnic population, and Deborah talked about screening and prenatal being low. But you don't get the reasons why. Why is this happening? As I've said this to Birmingham, why are these things happening in a diverse city or as in the Midlands? Why we're so diverse and yet we still have the problems with ethnic minorities? And I think it's a lot to do, Deborah may be wrong, I've got a feeling it's to do with culture and the training and education, if I use those words lightly. But I just think there's a lot of fear involved in certain quarters, which is why I don't think they're going to get the screening and prenatal and everything else, Chair, that I think needs to be in the mix here. But my one question is where is the number one, is any comments that we've had to the wellbeing boards from any, as Stephen said, from the West Midlands Combined Authority as a whole, and where is the in-depth report showing all the benefits?
Okay. Thank you, Peter. Michael, and then I'll come back to Sean.
Thank you, Chair. I'm only Michael when I'm in trouble. That's what my mother used to say. Yeah, very simply, I am fortunate that I do sit on the Worcestershire Health Overview and Scrutiny Committee. And so I do get sort of information about what's happening in the Worcestershire trust areas. My concern is that being the representative for the North Worcestershire Non-Constituent Authority, when's the overflow? Because what we're seeing here is exactly what, if you like, the whole country needs. And how long will it take before this sort of oozes out of the West Midland Combined and into the non-constituent authorities areas? Because it seems to me to be a fabulous idea. How we do it, what it costs, what the implications overall will be. But I do know that we've got spare space in the Kingfisher Centre in Redditch. So if you want to put a centre in there, please do so.
Okay, right. You never miss a chance, do you, love? Okay, Sean.
Thank you, Chair. So yeah, getting to this position. So this was a speculative proposal we put through at the very, very beginning of the in February for the original budget proposal. And then it's been worked up a few times now to go into the comprehensive spending review. So the reason we put this together in the first place is that when we did a piece of work, it was primarily with the Birmingham area to start us off, because it is a pilot. So we haven't gone to all of the wellbeing boards across the whole of the region, and that was because we were specifically thinking about Birmingham and Solihull to get the money over the line for the first bit, but to try and get the proposal to understand it as a pilot and then scale it up across the region. So when you talk about the volume, when we were thinking about this in the very, very early days, we had the information we were given by the Transport Network and the Footfall Network for the city was telling us that we were seeing 50 million people a year using Grand Central. We were seeing 170,000 commuters every day through that site, and therefore we had an opportunity for people to come in to use this venue. We know that actually across the West Midlands in December last year, when this was being worked up originally, that we were trying to screen 340,000 people, and it was averaging waiting time was about 2.5 weeks for a screen. And then actually the time that we were taking the referral from the screening being completed through to the review process was taking in excess of 6 weeks in a large number of cases, which is totally unfair to the individual who's gone through that process. So using the 5G network, what we were able to describe that actually we could build on a proposal that would get a CT scanner into the unit that would see 5,000 people a year. We would get about 7,500 people with mammograms done per year, and we would turn that 2.5 week waiting list down to 48 hours. That was what the proposal was all about, trying to speed up the delivery, try to speed up the service so people had a greater access. I absolutely take on board all of the things that you've said about actually is the Grand Central the right location, but it was a opportunity that has come up for people to try and use that venue because people will be in the city centre. It has a small area around it to be able to go to test it out. The other bit then is about actually how that then correlates out. One of the things that we wanted to do is to see how do we make it available to other people from outside of the Birmingham and Solihull patch. So how can we start to share data? How can we start to share records? How do we enable that referral service to be more accessible to people? So really building on all of those things that we've described, we actually wanted this to be a centre of excellence then that could be used across the region, and we could really learn and use the data elements then to be able to see whether that would work across the broader region.
Okay, thank you, Sean. Stephen, I noticed that you've got your hand up, but we'll pick up on any points that you may have in relation to under the comprehensive spending review item, because it is within that. If that's okay, I am keen to move on to the next item. Can I just pick up on my colleagues' points? And I do, Deb, utterly get your point about, the importance of public service reform. But again, I think one of the issues that, and Stephen referenced it, you have around this table, a lot of us are really committed to devolution and we're committed to a combined authority. And I think one of the challenges that we have is actually ensuring that there is an understanding at what spatial scale and what sphere of governance that the combined authority is operating in. And clearly, public service reform is absolutely key for something at a regional level. But it's at what point? What I think is also a concern, and again, we have this from an economic point, but all of these pilots too often happen in areas or to the people who actually have the least need for it. So if you are seeking to address inequality, and that is what you have said so far, that was in your presentation, then Grand Central is clearly the wrong place. If you are trying to actually prove a case and show an benefit to employers in the city centre by having early diagnostic, then it might well be the right place. And it's, again, the important thing of being absolutely clear and specific about what you're trying to achieve. And if, again, you're going for a easy to hit client group because you want to prove 5G and the technology, then fine. But can we be upfront? Because I think the difficulty we do is almost we try and tick so many boxes, it's never quite clear what it is. And, one of my concerns is, and I've made this comment before, I can remember when I I made the comment about Birmingham that at one point we had more pilots than British Airways. We really, really need to ensure that when we put forward a pilot, has it been mainstreamed? And unless you have got the transition into mainstream, actually, is it justifiable given the limited resources we have? Maybe we can sort of reflect on that a bit more in the economic recovery, but I do think that kind of thinking needs to feed back. Okay, colleagues who've still got their hands up, Peter Fowler, could you drop your hand, please? And I had a chat thing come up then. Okay, mine's been disabled. Okay, item 6, Julia.
Thank you very much, Chair. So the paper that you have is designed to give you an overview of the broader economic recovery planning and then to put that recharge investment proposition activity into context. So what this paper does is give background and a bit of a recap of activity to date, including how governance has been organised and just really pulling out 4 key strands of a recovery activity that's been happening since we stood up our economic response to the pandemic in the spring. So there are 4 key components there. 1, an overview of our approach, including just being absolutely clear about how we are phasing our approach and the unpredictability of what this kind of future recovery is going to look like, and the 10-point plan signed off, the 10 priorities signed off by leaders that were going to guide our response. A second piece around intelligence and analysis. So at the last CA board, we presented an updated state of the region report. So in addition to tracking kind of consistent metrics on an annual basis, giving some analysis of what we expected the economic impacts of the COVID pandemic to be on the region, and then also thinking about how that was going to play out across various sectors and kind of wider global megatrends that would impact on the West Midlands. Then we get to a third section, which is about the short-term case to government and our short-term response. This is the context in which the Recharge West Midlands document sits. It's absolutely about making the case to government to say, here are existing proposals and activities that, with your support, will quickly start the West Midlands economy. So this is about kind of a wider regional submission. So it's supporting activities from a number of institutions across the region. It's not about the allocation of existing resource, it's about kind of pitches for new resource. So that's where Recharge sits. And then, of course, all of that work then helped inform our response to the announcements of the Get Building Fund, which meant that we were able to use that and the other projects that came forward as part of that Recharge building case to enable us to respond quickly to some very short timescales to set out how we would spend our allocation of the Get Building Fund. Then finally, there's a short-term piece around the long-term reset of our economic strategy. So this is where the devolution white paper sits. This is where kind of the fundamental review of our local industrial strategy, aligning with the national review of industrial strategy too, to understand kind of what those longer-term interventions are going to need to be. So the paper goes kind of recaps on our governance arrangements. Section 2.8 also gives information in terms of the criteria against which we assessed potential projects, which does include a value for money requirement. And then just looking ahead to future activity, we are, of course, continuing to focus on ensuring we are following through on Recharge document, and the appendix to the paper gives you a bit of an update on where we are on that. So which of the proposals put forward have we either secured resources, or are we playing into national government announcements? The steering committee is focusing on areas of immediate government interest and those that we are carrying forward to the spending review to make sure that we're not losing those propositions. And the said board is playing a lead role on helping us develop our future strategy refresh. And as I said, that is about using the assets and the material and the priorities we identified through our local industrial strategy, but also just making sure that we are aligning that with national government's industrial strategy refresh. It's absolutely about taking account of the local recovery and devolution white paper. And then I suppose just to recap on the roadmap from Recharge, it wasn't just about pushing forward on the propositions. It was absolutely about making sure we were aligned with the devolution white paper. It was around making sure that we were following through on Recharge, but also that we had clear protocols for how we respond to future potential new funding stream announcements. So that is also something we're working with partners to make sure that we've got a really clear set of arrangements so that stakeholders and partners across the region have a clear process to engage with. So that's a recap of where we are. And as with Overview and Scrutiny Committee, at CA board, we are updating at each board where we stand on economic recovery. So this set of material will be incorporated as part of the cover paper to the CSR paper that will be going to CA board later in the month. So I hope that provides some useful context. I think for me, it's really important that the committee has the opportunity to do deep dives into individual propositions, but also kind of sees the broader kind of landscape in which those individual propositions and actually the recovery proposals sit.
Okay, if I kick off in the absence of my colleagues' hands waving, and then possibly they will come in. And it could be my confusion. I totally accept it might be, but we were very clear that we wanted at this meeting a tracker that set out what we had bid for, what was coming through, as in what had actually, what was in the bank, to what was approved, and also as to what the outcomes and outputs were going to be. And the other thing we asked for is that needed to align to the presenting need and what COVID had done to our region. And whilst I can see a list in table 1, table 2, 3, 4 of national bids and the areas we've gone for, I can't see anything that provides for transparency and accountability in terms of us as a committee being able to clearly scrutinise and understand what we bid for, what we've actually got, and how that relates to the actual changing economic profile of our region. This is just a list of projects with a list of government funds, and you have to, it doesn't even break down what the regional allocation was of the national funds.
We don't know that in every circumstance at the moment. Sorry.
Can I just finish, Julia?
Of course.
The other concern I have, and I had asked for it, and then I didn't get it, but I've managed to get it this morning. I'd asked to actually understand those sort of the baseline beyond the city region, city ready figures that go in your state of the region. And you suggested that the said board tracker would be helpful.
Yeah.
Well, I've now looked at the said board tracker, and it's interesting. It has a huge emphasis on FDI. It doesn't necessarily have an emphasis on business survival, business save, transitional measures. So I suppose one of my concerns is, are you measuring the right things are you using the right data to inform your decisions? And out of all of this, I am still, if I was to be asked by my colleagues, and I think I've got to present to full council next month or something on the combined authority, if I was to sort of summarise what we'd gone for and how it was going to address the jobs lost, I haven't got that in one place. And I do think we actually have to get to the point where there's some transparency in this process. Happy for you to come back on that ahead of other colleagues asking, but I think Stephen's on another call. So, Julia, do you want to come back on that before? No doubt Stephen will come back.
Thank you very much. So what the tables at the end of the paper try and do is provide an indication of where we think our proposals are plugging in. This continues to be a moving picture. So at the financial update earlier in the summer, we had some national funding schemes announced, but not the detail of the regional allocation. So where we have knowledge, we are absolutely specific. So in table 1, for example, we are highlighting those projects that are being funded, that have been secured through a result of the Get Building Fund, for example. So where we have certainty, we are pulling that across. There are other areas where we do not, because there have been national announcements that we know will have local implications yet, but actually the policy hasn't been finalised. So, for example, on affordable housing, we had some funding announced on brownfield at the summer financial statement with an allocation for the region and a competitive pot. So we're in the process of applying for that competitive pot. But what we don't know is what the detail of the approach is on the broader affordable housing. So our role at the moment is trying to influence that national policy making process rather than it just being a mechanical, being able to report on an allocation. So
that's fine, Julia. So why can't we have a tracker that says that? Because it's all, I utterly accept this is an iterative live situation.
Yeah.
What we haven't got is any comprehension of the iterative live situation.
Okay, well, I am more than happy to revisit this material to try and ensure that the committee is getting the information that it needs. And we can certainly go away and look to what economic, to your point around kind of the changing economic profile and how these are addressing it. We can also look to include that. But as you say, the problem is there are multiple different categories of activity. It's not purely a kind of an accounting spreadsheet that's going to be able to provide you with the information that you need in terms of what resources have been secured and which are kind of still in play and we're pursuing with government.
So I suppose just as a simple example, and again, it might be I've missed it, but you had an inclusive growth framework, and that set the kind of things we should be measuring to ensure that growth is inclusive in the region. We then have a SED board using data and things to track and inform its decisions that bear no resemblance to your inclusive growth framework. So it kind of feels like we've got a parallel process instead of an integrated system change. And it's only by changing the system are we going to address this inclusive growth. And it was briefly referenced by Sean, and I was bound to pick it up. It comes up in the comprehensive spending review. The sheer nonsense of thinking about economic recovery separate from community recovery when you say that your key priority is to address inclusive growth as a region is quite frankly beyond me.
Okay, so the information in the SED tracker, so part of the challenge that we've had previously with the state of the region as well is the scale of some of the lagged indicators. So whilst on an annual basis we can use that kind of summary report to board, if we're trying to kind of watch live indicators that are moving much closer in real time, I think what the SED board tracker does is reflects things that we are likely to see some movement with between monthly SED board briefings. But the broader tracker is aligned. We have aligned explicitly with the Sustainable Development Goals to ensure that we are consciously tracking what the information is giving us and how it relates back to that broader picture. The challenge that we have is at the moment we don't have the regularity of data across the board on the key metrics that will help us inform that. So what we are working on is where we can get hold of that information. What are the proxies? And an economic impact group, there have been discussions, like a critical part in all of this is and kind of the transition back to getting the economy up and running is going to be about confidence. And we are kind of looking to see what metrics we can have that will give us closer to a real-time understanding of what is actually going on in the real economy. So it continues to be work in progress. We are, Beck Riley, who leads on building both the state of the region and the tracker with the Black Country Consortium to SED, has been very closely aligned with the development of the Inclusive Growth Toolkit and the metrics that they use. We are working to ensure that all of these are aligned, but the reality of the data that is available in the kind of cadence that we're after doesn't always align. So we're trying to make the best of not having access to full information all the time.
Okay, thanks for that, Julia. Deborah.
Thank you, Chair. I don't want this committee to get so embroiled in the detail, and I'm not suggesting a tracker would be unhelpful, and I think it's absolutely right. But don't allow that to detract you from the really important issues, which are the fact that we were on a really good trajectory before COVID in terms of economic growth and acceleration through our industrial strategy. Then COVID hit, and all the things that we believe to be true are now kind of up in the air. So all those sectors that we were backing are now subject to global influence, and we're having to change some of the direction on that. And then aligned to that, a kind of central government initiatives that mean that we are a bit like kittens chasing, lights on the wall, because government are saying, look, there's this pot of money over here, bid for it, and we're all scurrying over and bidding for it. And I think it's right that we do. So, I mean, it would be it would be wrong of us not, for example, to be responding to the Kickstart opportunity, because we know that when furlough lifts, there will be significant numbers of unemployed people in this region, predominantly under 25. So we have to kind of respond to that. But equally, there are longer term things that we still have to hold true on, like 2041 and the Gigafactory is part of that. You know, so in order for us to achieve carbon neutrality by 2041, and you can argue whether that date is right or not, but the issue is we do need to achieve carbon neutrality. And in order to do that, there will be parts of a jigsaw that we need to bring together, like a gigafactory, like electric charging point infrastructure across the region. There need to be associated skills development. There will need to be our ability to attract electric car manufacturing into this region. So there are longer term things that we need to stay focused on, but at the, you know, alongside that are those short-term opportunities that we have to kind of bid for. And the whole, you know, the majority of this document is around our ability to respond as a region to the short-term opportunities that are coming up as a result of COVID and the impact that's had on not just the regional economy, but the national and global economy as well. So what we're trying to do is make sense of this, but you know, underpinning all of it. And if you ask any of the people, you know, any of the people that work with me in the combined authority, our main prime focus is to ensure that we maintain, you know, a focus on growing the economy. So, you know, the economy needs to be sustainable and needs to grow, but alongside that also needs to be investment in our communities to allow them the opportunities to bid for any jobs that come, also to protect them from unemployment and everything else. So I guess what I'm trying to say is this isn't a linear, you know, kind of obvious kind of set of actions that we're taking. It's really messy. It's really ambiguous. Some of it is about us taking advantage of opportunities whilst also maintaining true to the stuff that we know will both protect and provide resilience into our economy and allow it to continue to grow. So it is really messy, Chair, and we're trying to make sense of it, but we're absolutely clear that there are a number of things that we need to do in order to ensure that the residents of this region can still access opportunities as they come up.
Okay, thanks for that. And I don't think, to be fair, it's a case of the committee wishing to get bogged down in the detail. It's, you know, I think we accept it's messy, we accept it's iterative, and indeed, you know, it is a whole set of different parts of a jigsaw. What we do need, and, you know, I know my children would say I have OCD, is I don't want the jigsaw scattered all over the floor.
No, that's right.
I absolutely want to be able to understand its fit. So we just actually, what I thought the action tracker would be some kind of the tray that we can at least see how those different pieces are going towards the final picture.
Yeah.
So what we want is we want the picture and the tray. I mean, I must be, you know, I'm finding a few of us, and I don't know if it's an age thing, but, you know, I start to hark back now to those days of the RDA where you actually did get, you know, spreadsheets and a set of documents that I actually knew where money was going, what it was delivering, and what the supposed outputs are. That is the kind, and I know we can't cast it in stone in that way, but we should be able to have some clarity, because it's only when you put it together you can actually check sometimes whether you're backing the wrong horse. And that's what I don't think we've got a sense of as scrutiny, is whether you've actually backed the right horses.
I accept that.
And if it's helpful, Chair, I'd be more than happy to spend some time with you between now and the next session of the committee to ensure that you've got a tracker that kind of gives you the information in a way that you need it. So I'm more than happy to have a couple of turns at the wheel with you to help make sure that you've got it.
That's great. Thank you very much for that, Judy. Ahmed, Councillor Boston.
Yeah, thank you very much, Chair. And grateful for the points made by Deborah as well in terms of the context of this, because I can't help but think, does this sit under, if this is about very much going for whatever's out there, and I completely understand that, and I completely understand the need to be bidding for that, does that sit under a wider inclusive economic growth strategy where people and communities are taken with it? Because I don't understand from the document where this fits into communities. For example, in Sandwell, we're talking a lot and we're doing a lot on community wealth building and taking communities with us in terms of pre-COVID and post-COVID. But I don't understand in terms of this document how we're getting communities involved in this, how we're going to ensure that some of those challenges that we're facing, what's the long-term strategy, I suppose, is what I'm asking. There's a lot of short-term stuff here, which is fine, which is good, but how does it fit into a long-term strategy, and what is that long-term strategy? Thank you.
Thank you. Councillor Richard Brown, and then Councillor Stephen Simpkins, and I'll come back to Julia to wrap up.
Yeah, thank you.
Thank you, Chair. Probably would describe myself as probably old school here and struggling in the new world a little bit. And I take your point, Deborah, that this is a bit messy and we are struggling to make sense of it. As I was sort of reading through all these tables, etc., and I'm struggling to know what it is I'm looking at. And for example, and I'll be boring here because I talk about 5G. On table 1, we have a 5G accelerator line in brackets 28 million. So I look across and then I see 1 million for WM 5G application accelerator. I don't know what that's telling me. Two numbers there, 28 million for 5G accelerator and then 1 million. What is that document telling me? Should I be excited by that or should I be concerned by it? And so I sit here in my sort of with my scrutiny hat on, and I don't know what to make of that. And that's really the only point I really wanted to make. As I go through this, I don't know what message I'm supposed to get from these tables. Sorry.
Thank you, Richard. That's helpful. Councillor Stephen Simpkins.
Thank you, Chair. I find it difficult to say that when we've got all bits and pieces of jigsaw and you know, after post-COVID, surely COVID should be an indicator of the weakness of in all our infrastructures. Surely that should be the template of how we rebuild the future, not just now, but in the future. Surely that should tell us about the supply chain and about engineering and light engineering across there. These are the sort of things that we should be invested in. It'd be interesting to see what the breakdown is in areas, Birmingham, the Black Country, Solihull and Coventry, what the material benefit is. I mean, back to that one again, are we value for money that we're trying to invest in? Because it does seem to me that we've got a strategic plan that gives us that guidance where we can scrutinise value for money, but also scrutinise the delivery when building people's futures in the West Midlands. And that's what we should be focused on. So we need to make sure that we get the right things in the right place. So we need somebody with a vision and a nous to put the jigsaw pieces back together so as we can understand exactly what's taking place. And the opportunity to call government out when it's the lack of investment. We shouldn't be chasing pots. We should be making argument for them to invest in the West Midlands the other way around. Communities should fit at the top of that jigsaw, where communities then reflect back into the economic growth, because it's people who buy stuff, not companies who produce it. It's people. And if we invest in the people, that'll grow the economy. So we need clarifications of value for money. I've always been criticised by the Conservative oppositions in my local authority. Value for money, what's the delivery? And I'm doing exactly the same to the Mayor and the vision that he wants us to move forward with. That's what I'd like us to focus on.
Okay. Do you want me to come back, Chair?
Sorry, I was trying to arrange my cup of tea. Julia, do you want to come back on that?
Yeah, thank you very much. So in terms of how this fits with community recovery, so as the governance diagram sets out, the critical point where kind of the region has the opportunity to ensure that these economic and community recovery strands are coming together, and the complementary roles of all the different kind of institutions in the region are kind of doing their bit, is at the recovery forum. So that's the kind of purposeful thought behind that process. So there is the opportunity for that discussion in the round. In terms of the longer term strategy, I suppose that was really the purpose of the summary paper, really just to reinforce the point that to see recharge in the context. So it was a start of a 10 on things that we could do to support economic recovery, but actually that longer term work around resetting our economic strategy is going to be something that we're going to need to build out and kind of evolve as we know more about what the kind of longer term economic impacts are on our region. So we have some good, we've got the assets from our local industrial strategy that helps us understand the exposure of particular sectors, particular regions of the economy, but actually until the furlough process is fully unwound, we're not going to know what the real world economic impacts are until we get closer to Christmas, and things like the Brexit negotiations are also going to play a material difference. So we need to make sure that we are working through that long-term strategy, but with an eye to being able to having something that can respond to what remains a very, very uncertain situation. So part of that strategy work, what is going to set board next week, is some proposed future work on helping understand what those future scenarios look like and where further work is required to enable us to model them properly. In terms of kind of what to make of the document and the right level of detail, so it's designed to be a factual document. I wonder whether kind of what your comments are telling me, that we haven't got the level of detail sufficient to give you an understanding of what the things that we're summarising are describing. So I do think that is something that I'm more than happy to take away, so that you can so what the document is designed to do is for you to understand how the recharge propositions fit into announcements that have been made and future activity, whether that future activity is on our side to build them into our spending review proposals, or whether it's engaging with government as they develop their own policy proposals, and where we are ensuring that that kind of our broader aims, we're making the most of the short-term opportunistic reactive stuff, that we're not losing sight of that longer-term picture that Deborah was talking about earlier. So again, happy to undertake to work so that you've got access to kind of more information about the projects and announcements that are being described to help you draw those conclusions yourself, Councillor Brown. And then to Councillor Simpkins on so as I said, what the recharge document was assembling propositions not just from the combined authority but from a number of partners. It's a mixture of revenue and capital proposals, and some of those individual organisations will take their own kind of methodological approaches to value for money, and obviously there's a distinction between revenue and capital too, but actually that process of building those propositions has sought to drill down into all of that information to allow us to make kind of value for money, impact and scale and other assessments, and I think that is and should be visible on a kind of proposal by proposal basis as we secure them. Again, the part of the kind of delivery monitoring will be part of those announcements. And we can come back to the committee to give you visibility if helpful where we know it. So, for example, we don't know yet on the kind of regime around the Get Building Fund allocation, but that should give oversight of delivery. Other announcements will be mainstreamed into other thematic portfolio delivery regimes. So in each of those cases, there will the organisation, there will be visibility of delivery on how those projects are being delivered.
Thank you, Julia. Ahmed, is your hand still up, or is it by? Are you wanting to speak again?
No, I'm not sure. No, I'm not sure why it hasn't gone down.
Okay. Okay, no worries.
Thank you.
Deb, did you wish to come back?
Yeah, it's just a quick one, Chair. I think what might be helpful is if we at a subsequent meeting we bring the work of the community recovery group that we have in play at the moment, and Adam's on this call, but Adam was worked with Ed to pull together a systems panel looking at priorities for community recovery. I think you know about that, but it might be helpful to just scrutinise what communities are saying are important for them to recover from COVID and to participate in economic growth. So, you know, our people, and it was a representative group from across the region, was saying what's really important to them is around living with coronavirus and how we do that, but it was also around physical and mental health, and it was about how, you know, we can promote healthy living to make people more resilient if they catch the virus. So there's a really important piece there around diagnosing, treating, supporting people to be as healthy as they can. You can see that links into the work that we're doing on the diagnostic centres. There's also around mental health support, recognising signs of mental illness and being able to mobilise our health support for them, addressing vulnerability of recently unemployed people, so that's young people and the elderly in particular. It's also about supporting teachers and employers so they can be trained to spot issues and offer support. Okay. But most important, it was around supporting our children to go back into the school environment and also supporting them to make up for lost time. We know that if we're not careful and we don't do this, there will be a whole cohort of our young people who will suffer from being out of the school environment for 6 months. And we're already talking about the implications that that's going to have for people and exams next year. And then more importantly, our people, our residents were saying that there is a real need to create new jobs and to give people the right skill set to enter the workforce post-COVID, and get people who have lost their jobs from COVID-related reasons back into work as quickly as possible. And it's also about promoting and supporting businesses, especially, you know, smaller local businesses, self-employed, you know, by encouraging people to buy local, etc., etc. So there are a whole range of things, Chair, that we're doing with our communities that I think need to be played into this scrutiny committee.
Absolutely. And the things you've just said, I think, are absolutely the things that the members on this panel, because don't forget the members on this panel represent communities and citizens of our city region.
Absolutely. So it's then that read across, if I may, Chair. So you need to look at all the stuff that Julie has spoken about and say, is this addressing those things?
The marry up between that's what we want to know. What's the marry up between what communities and our perception of what is needed for our cities and towns and what's coming forward?
Exactly.
And what is actually benefiting the communities and what is actually benefiting the corporates? Because at the moment, it is very difficult for us to be able to judge what the real value added is for the communities we serve.
Yes.
I do accept that, you know, partly, and I hope Adam will pick this up in the next item, it's about actually having some sensible funding for devolution and regional governance. It's also about actually ensuring that what we do put forward is really relevant to our region. And we have to be really careful of is almost post what. So we all know that the industrial strategy was not necessarily about where our industrial strengths were or where we should go. It was what we thought 5 things the government had asked for us. What I think is absolutely great and important is reframe of that work.
Yes. Yeah.
So are you asking a question, or can we move on to the comprehensive spending review and pick up any remaining issues there?
I'm just very quickly asking.
Sorry, Peter?
I'm just asking a couple of very quick questions.
Yeah.
Relevant to what you said about the tracker, etc. I know that Stephen refers to this, and it is always helpful. But when I'm looking at the tables 1 through 4, although it does say areas, one thing that I always find helpful with the West Midlands Authority is that it's always helpful, though it does say in here reflects to Dudley and Coventry and other areas, but it's also helpful when members see certain projects, this, certain, the other, where it's targeted to, who benefits, where it benefits. So if it's going into the Black Country, for Stephen, or it's going into Solihull, at least we all know, then we'd get this visual, as Stephen called it, but you know, the piece of the pie. And I think that's helpful. I don't see all that at times, and that's when I hear around the table, where is the Black Country in this? Where is Shropshire or wherever in this?
Any conservation, Peter? Birmingham's done pretty badly.
Right, thank you for that, Lisa. And the other thing is to Julie and to Deborah. There was this 10 points or 10 priorities of COVID, post-COVID-19 recovery plan. Is this part of the funding related to the recharge of the West Midlands, firstly?
Sorry, can you just repeat that last question? I just want to make sure I properly understood it.
Yeah, sorry. I saw somewhere a hyperlink, and I went into and printed off where it talks about a West Midlands roadmap to secure a successful post-19 economic recovery, focusing on 10 key goals or priorities. Is this part of this of these tables that I've got in front of me about the economic recovery asks and funding?
Yes.
Thank you. So I am seeing, interestingly enough, that of these then, that the 19, as it's called, the COVID-19 Economic Impact Group, along with business leaders, central banks, trade unions, and local authorities, including the Combined Authority, all have supported these points. Am I right?
Yes, that's correct.
Thank you. That's what I thought it meant.
Yes,
thank you.
That's correct.
Do you come back on?
No, thank you. That's really helpful, and we will work on the tracker.
Okay, and I did notice your consternation when I made the comment about the industrial strategy. Actually, that was what Patrick advised this committee when we discussed the industrial strategy. So I'm only referencing back what we've been told as a committee.
Yeah.
And I share your consternation. So let's move on. Adam, are you with us for the comprehensive spending review, or is it Julia for another dose?
No, I'll give Julia a break. It's me for a start.
Okay, thanks, Adam.
So I'll talk briefly about the paper, just give some context and to highlight some of the key items in it, and then very happy to take comment. It's important to flag that this is pre-decision scrutiny. This paper has not yet gone to the CA board, so there's opportunity here prior to it going to the board on the 18th of September. So at the end of July, we agreed a process with local authority chief execs and leaders, as well as the mayor, to produce a shared regional submission to the comprehensive spending review that governs for local government, referencing some of the discussions in the committee thus far, ensuring that resources to back that up. Secondly, a principle around levelling up, an agenda that's been driven in the West Midlands for some time prior to it being popular in national government, but ensuring that we're hitting those beats of regional inequality being tackled in human capital. And then thirdly, around a green, and that really forward bits of work we've already discussed in the committee thus far, the economic recovery work, both the recharge document and the wider work that Julia had discussed. And in the cover note, we have a hopefully simple table that shows how the recharge asks are reflected in the CSR representation, but also the community recovery work, and Deb referenced the citizens group of the public and work that's public services element of the CSR representation has been driven by local authority chief execs, principally Nick Page at Solihull and Tim Johnson at Wolverhampton, to make sure that wherever the combined authority is proposed to take a role, that is adding value and that activity is taking place at the right spatial level, and that work will carry on after the CSR. So the document you have in front of you is a more detailed set of funding proposals, deliverability, and a strategic beneath each of them. And I'm very happy to share that detail with the committee in areas that would be useful. The document the board for their science, the more detailed work that goes to the Treasury. And to quickly run through it on a package level as opposed to individual proposals, there's firstly a package around structure that's been led by Boris Schoaf at the Combined Authority and Mary Morrissey, the Director of Economy and Infrastructure at Solihull. That includes a single pot for infrastructure, pulling together the capital asks that we need around transport, housing, energy and digital, and has a specific focus there on UKC as a transformative regional project, and also includes proposals around natural capital, ensuring that green and blue space are part of our proposals. Secondly, there's a package around economy and skills that was led by Charlotte Johns at Wolverhampton and Julia Goldsworthy at the Combined Authority. That focuses on three main bits: one around business resilience and productivity, some of the key asks in the recharge document around business support, finance, innovation, and R&D. Secondly, around employment support and skills, both those skills proposals to ensure that we can have the people working in the industries that we've set out in recharge, but also the Thrive programme to ensure that people with long-term health conditions or mental health challenges are able to enter the workforce. And finally, there's a proposal in there around culture and placemaking, recognising that it's important not just that we support the cultural sector, but the role that culture plays in attracting talent and improving quality of life. Thirdly, a package in there about public services that was led by Ed Cox at the Combined Authority and Jonathan Chew at Birmingham City Council. 5 proposals in there, one around homelessness, building on some of the really excellent regional collaboration that's taken place on that issue, clearly even more important now in the wake of COVID. Secondly, around public service data and evidence, trying to get investment into the data analytic capacities of public servants in the region. Thirdly, a regional safe centre for vulnerable children, a proposal that local authorities and the OPCC have been working on for some time. Fourthly, public service resilience. This is one of the issues that when we did work through the RCG was flagged by local authorities as being really important for regional investment. And finally, around health inequalities, building on some of the work that Sean talked about earlier in this meeting. And finally, there's a package there around finance and financial sustainability. Really, that's the underpinning of each of the other 3 areas. And we've broken that down into 3 sections, or indeed, that's been led by Martin Reeves at Coventry, Linda at the CA and the FD network, who have really held the pen and been the authors on that. So that's the FDs at each of the local authorities. Firstly, around long-term sustainable financing, the figure we've got in there of around 1 billion is the revenue ask from all local institutions for what we need, given the impacts of COVID and also the impacts of years, if not decades, of underinvestment in local government. Secondly, around reset and recovery. So if we get that revenue funding, here is what we need to drive economic and community recovery. And finally, around flexibilities that are needed. And that's building on what was in our devolution white paper submission. Very finally, just to reflect that we've had some feedback on this already, so others are aware. Leaders on Friday were really clear that we needed to bring in some more of the language from the devolution white paper submission around double devolution, a systems approach, and particularly doing things at the right spatial level. And I think that echoes a number of the comments that we've heard from the committee already today. Comments from universities about ensuring that higher education is reflected as a sector. We had a session with Deputy Pro-Vice Chancellors of the universities in the region, and also from the local enterprise partnerships, who are keen to see some of the schemes they've been working on with the local areas reflected. And throughout this week, we're going to be making some of those changes and amendments before board papers are circulated on Thursday. The board read, comment, and hopefully approve it next Friday. And then it is submitted on Monday, the 21st of September, meeting the government deadline of the 24th. So that's a bit of a kind of quick run through. I'm very happy to provide more detail or to make any amendments and edits.
Councillor Bob Grinsell.
Thank you, Chair. I'm really quite pleased and obviously vested interests with this draft. And I noticed on page 37 of the single pot approach on infrastructure in respect to the HS2 interchange station. I'm vice chair of the planning committee that passed recently the 3 applications that will be before us, one for the station, secondly for the people mover, and thirdly for the access and parking. I would comment that but for a section 106 agreement that was in place on the access and surface car parking, my view would have been that the committee would have refused that application purely because we felt that we're hoping that a further proposal will come forward to us at the planning committee here in Solihull, because at the moment there really is a great waste of space due to the surface parking, and obviously if a alternative proposal were to come forward, the land would be much more, the valuable land would have a great asset in providing other suitable projects, and not waste space on 7,000 vehicle parking on surface. I just wanted to comment on that, Chair. Thank you.
Thank you, Councillor Grinsell. Councillor Chalk.
Thank you, Chair. Two things. I've obviously missed where the paper is because I'm not aware of it. And the other one, which was a little bit more concerning, Adam mentioned the fact that there'd been public participation, and I'd just be interested in how he achieved that public participation under the circumstances when I haven't had a meeting with my fellow councillors for 6 months, let alone members of the public. So if you could explain to me, A, where the paper is that I should have seen, and B, how they took up, how they had the public consultation with people who may or may not. And I mean, how many people have got the computer facilities that we've got?
Okay, thank you. Councillor Stephen Simpkins.
Thank you, Chair. Yeah, well, we mentioned earlier about I've got the severe reservations about the hub at Grand Central. I don't think it's going to set out to achieve what has been said in the presentation today. For me, that we should hold back and think again about that delivery, to be fair enough. But what concerns me, for 4 years, we've been complaining about the lack of scrutiny and the lack of governance. The devolution paper should have something in there about how we hold the board, the mayor, to account properly. For 4 years, we've been queried how many times? You can count them on one hand, to be fair. That, for me, is a serious concern and a flaw within the combined authority. This is public expenditure, public funding, and it does, sadly, unaccountable to anyone, to be fair. And I really do feel it's such a missed opportunity. You talk about engagement with the communities through representation. That's what we do here at Scrutiny. And there's none of it here because of the stupid way that it was set up, in my opinion. We need to make sure that this is open and transparent. In fact, that's the catchphrase of the Metro Mayor. Open and transparency will be the way that he does his tenureship. Well, there's been none, in my opinion. And I'm entitled to that opinion. There's a lack of clear plans of investment and delivery and value for money. We need to address these big issues before we can ever move forward. That, for me, we need to have a proper discussion before this goes off to London.
Okay. Okay. Can I just possibly pick up on a couple of points, partly reflecting what Steve said, and then really the reality of the situation. I'm interested on the homelessness stuff, because I actually haven't been able to get the information from the Combined Authority on how many people are in temporary accommodation, how many people are in bed and breakfast across the region. I've been asking for that for a number of months, and there's been difficulties in obtaining that. And certainly from my perspective during COVID, I was absolutely horrified to actually appreciate how many families we really had in temporary accommodation. On one Sunday afternoon, we found 155 children in one hotel where they had no food, no access to Wi-Fi, no opportunity for education, and they'd been housed by 3 different areas from across the region. And again, it comes back to those children's early life opportunities are potentially already lost. And it's where we put understanding that the investment, where it needs to go and where it will make the difference. And again, I'm not convinced it comes through necessarily in this joining it up. And at times, I think it would be a lot better for all of the leaders and us in the region to actually have a few profiles of actually, you know, real life experience in here, the living, you know, what the living experience really is in the West Midlands region, and actually what would make a difference. And again, I suppose I understand the importance of commercial development. Equally, if we are concerned about the skills, the young people in the region, this scrutiny very strongly recommended a review of the policy of free transport for 16 to 18-year-olds going to college. It's seen as the cost of bus fare is seen as a major barrier to many young people taking forward A-levels at colleges of their choice. And, you know, the Mayor's response back to us was, that's not our policy, go away. Well, if you're going forward on a comprehensive spending review, you had a chance to put forward a policy. And again, I'm interested to know whether the issue of how we actually accelerate 16 to 18-year-olds. I know just from my daughter's old class, there's a number of kids who aren't going to their college of choice because actually they can't afford the bus fare. And I suppose my final point is, and I probably share Councillor Bob Grinsell's concern about the parking spaces. Mine probably more from a 2041 point of view as to why on earth are we constantly promoting things with huge parking spaces and to make it accessible to cars when actually we should be investing in the public transport infrastructure. But also it's this emphasis on Canary Wharf and the 1990s. Canary Wharf epitomises and was at the core of everything that was wrong about how our financial system and our system of regeneration and redevelopment operated for 20 years in this country. It's an approach that's actually seen housing become commoditised and people actually losing the opportunity for a home. I'm deeply concerned to see in a comprehensive spending review submission to government celebrating something like the Canary Wharf development, when actually we have such a massive problem of housing conditions, homelessness within our region. And again, I suppose it just keeps on coming back. I think there's some really good stuff in here, some really good proposals. What again I don't get an idea of is what's being prioritised. And one of the things is we can't fail another generation. So how are we going to pick up those kids in the bed and breakfast who've got no education? How are we going to pick up the people, the BAME community, Black community who live in really inadequate housing? And in this document, picking up on Stephen's point, you do again refer to the diagnostic screening hub as part of your levelling up health in the West Midlands. And again, what we would argue, just by its very location, if you are aiming for it to be a levelling up, it fails on that basis. Ahmed's now put his hand up. If I invite Councillor Ahmed Boston in, And then Adam, perhaps we can come back to you. Ahmed.
Yeah, thank you, Chair. I would very, very much concur with what you've said and with what colleagues have said. My concern actually lies in terms of priorities and what exactly we as a combined authority are pitching for. Are we pitching for investment, or are we pitching to actually address the inequalities in our region? And I think this is the biggest problem. For example, here in Sandwell, for example, we've had one of the highest rates of COVID, disproportionately affecting our BAME communities, and this will have long-term impacts moving forward. October is going to be a terrible month when the furlough scheme stops, because that's going to lead to a huge amount of mass redundancies across the region, no matter how much we frame it up. So how are we looking at our people's struggles and our people's issues and actually relating this back to what they stand for? And really, I think the focus around Grand Central, the focus around the glitz and glamour of the region won't get us anywhere in terms of addressing inequalities. And actually, the wider discussion we've had at the Combined Authority Scrutiny recently around the fact that how many people know what the Combined Authority is, how many people know what it actually impacts in their lives. I think this is an opportunity for us through this spending review to actually introduce projects and initiatives that can really bring the Combined Authority home to our people in our wards and our constituencies. That's where the real value of the Combined Authority will be felt by people, and that's where we can look at our purpose in terms of going forward. Thank you, Chair.
Thank you. Adam, we're not asking you to comment on any of the political points we've made.
No problem at all. So I think there were a number of things there where we can make amendments to what we've included. So Councillor Grinsell, I'll take the comments that you made on HS2 away to the transport team, the infrastructure team that put that together, and amends to reflect. And also there, Councillor Trickett, picking up some of the comments you've made about how it relates to the 2041 agenda, particularly. And I think on the language and the mentioning of Canary Wharf, I think given that at best there are ambiguous inferences of that project, then we can pull that out. Was that sufficiently apolitical enough? I did my very best there. On the specific you raised, Councillor Chalk, around public participation, so very happy to share directly with you the exercise we did. It was all online, it was done through Teams. We worked really hard with the provider to ensure that we got sufficient representation from all communities. We did, in the end, have varied socioeconomic groups participating, including people in the DE group, as well as focusing on people that have been furloughed and were from different ethnic groups and different age groups. So I can share some of the information on that. But it was actually led by Councillor Bridget Jones, chaired the working group that was doing that, and we focused really hard to ensure that was an inclusive exercise. So I'll share some of that information with you.
That's fine, as long as I'm happy that it was dealt with.
Yeah, good. And then on the kind of broader points about the balance of the package, Councillor Trickett and Councillor Bostan, those were comments that were absolutely made by leaders as well, in ensuring that there is equal emphasis on and importance of the economic and the community recovery. Of course, we need those interventions in the recharge document that are about creating jobs and boosting investment in the region, but they will not be successful if we do not have investment in communities. And I think because the recharge at a slightly faster timeline and to a specific earlier government fiscal event, that summer budget, it's been developed slightly more. We've got an opportunity now in the next version that goes to board to beef up and increase the emphasis on the community recovery, and we'll do that in the next document. And also finally, Councillor Trickett, on the homelessness element, I'll ensure that you get those numbers. I'll speak to the team and then pick up any specifics on that proposal before it gets finalised.
I'm failing on the mute button so many times today. Okay, Deborah, you wish to come in?
Yeah, there's just a couple of reflections, really. So the kind of CSR proposals have been through portfolio holders as well, and I was just reflecting on whether it would be helpful for ONS committee to have conversations with the portfolio holders as well, to assure yourself or reassure yourself that those leaders who are responsible for a portfolio are fully involved and included in the decisions that are made to include some of these projects. I do think that's quite important. And then in terms of the homelessness issue, of course we'll get the team to do the pulling together the stats and information, but it might be that you want to ask Jean Templeton to attend one of the ONS meetings to just talk through the work that she's doing in the homelessness task force, which is really impressive actually. But again, to assure yourself that the right focus is being put on to those who are homeless or sleeping rough on our streets. Thank you, Chair.
Thank you for that, Deborah. And perhaps what we can do is actually pick up when we have the conversation about what we're going to do with the governance review, because what colleagues might want to be aware of, one of the things we actually found was a major problem with that is the portfolio holders did not actually have time to adequately contribute because they were leaders of councils in their own right. They weren't actually having the opportunity to properly contribute the sort of investment and understanding into what was going on. So we have quite a officer mayor surface process. And again, one of the concerns that I think we have is the strength of the combined authority will lie in how actually it starts to show it is adding capacity to the local. And unless we can show that golden thread, we have a problem.
Yeah.
Okay. Thank you for that, colleagues, and thank you, Adam, for your commitments to take forward. Forward item 8, forward plan West Midlands Combined Authority. Lindsay, anything you wish to say?
Yes, Chair, thank you. So within your packs, you should have the forward plan for the WMCA board and also the forward plan for this committee. You'll see that we have the mayoral Q&A session coming up shortly on policy. So for those members new to the committee, this is the committee's opportunity to hold the mayor and district to account in respect of the WMCA policies. So if members feel that they'd like any information in advance of this session to help form your lines of inquiries, if you let myself know or a member of the team, and we can arrange to get that information to you. So that will be held on the 16th of October at 11:30. You should all have that in your diaries. The next meeting going into November, the 2nd of November, as touched on earlier, there'll be a focus on the Gigafactory project. And also we have the portfolio holder for housing and land coming into committee. Again, this is the committee's opportunity to speak to Councillor Mike Bird and forward any questions in respect to the housing and land portfolio. Going into December, it's the budget sessions. So we have a mayoral Q&A on the budget on the 11th of December. Prior to that, members will have an opportunity to attend a workshop in which you'll receive a presentation and be able to ask questions on the budget. So finance officers will be attending that. Going into next year, we're due to receive reports feeding back on the implementation of recommendations that have arisen out of previous scrutiny reviews. And then the Chair has raised an interest in respect of a task and finish.
Okay, I'll pick up on that.
Yeah, okay, and that's it. That's all I had to add.
Okay, thanks for that, Lindsay. I truly hope we will be able to have the governance review and some movement and participation with this committee ahead of March. That feels a very long time off. Colleagues, in terms of the task and review, at our last meeting, we discussed not just the importance of understanding the how things fed across the region as a whole, but again, a bit like how Peter and others have described, the importance of us having a drill down into one of our economic geographies to actually understand whether the proposals, the economic recovery proposals, were actually meeting what was the needs arising in those localities. There have been some discussions regarding some concerns raised by colleagues from Dudley, cross-party concerns from colleagues from Dudley, and also a broader concern that the Black Country, if you start to look at AI, if you look at Brexit, if you look at zero carbon, this is truly the part of our region that is going to be significantly challenged by transition. And if we're not planning for it now and investing in it now, there is going to be great problems. So, having spoken further to colleagues who are representatives of the Association of Black Country Authorities and the Vice Chair and officers, what we're proposing is a short, sharp task and finish that potentially is only a day, 2 days, but it actually just drills down into the very simple questions of, you know, is the Black Country getting a fair deal? What is a fair deal for the Black Country? And how do we actually ensure there is a fair transition, I think is what we're looking for. So what's the needs? What's the investment? What's the actions? What's the outputs? And it's just to balance it through. Having now done a bit of number crunching and looked, I'd probably be keener to also have one on Birmingham, but let's do the Black Country one first. If members are happy with that proposal, what I was going to suggest is that we have a Black Country member of this committee chair it, and then we have the opportunity and we invite the left representatives, both at an officer level and a chair level, to give evidence to this, as well as colleagues to give evidence from this committee. I think, Lindsay, the idea is that we will draw up some terms of reference and circulate those to the committee, and we can then attach them to the minutes potentially.
Yes, Chair. So the intention is to work with yourself and the chair of the Task and Finish group to draw up a scoping document. And then we'll bring that forward to the committee for approval.
Okay. I'm very conscious I haven't had opportunities to talk to a number of Black Country colleagues who sit around this table, not least the person that we thought might well wish to be chair. So what I will do is, if it's okay with committee, if you're happy to delegate that to me to engage with various colleagues. As chair of the scrutiny, I will also, it is my view that I'll sit within the, what are we calling it, task and finish, because again, what we want to do is ensure that there is a balance and understanding across the piece. But I think what will be really important is some very sensible tied test questions, so that actually this does, you know, it's a very specific piece of work that has some very specific outputs, because what I do want to avoid is our experience of the past where tasks and finish can become tasks and never finish. Okay, any comments, concerns about that proposition? Ahmed?
Yeah, thank you, Chair. I completely agree with what you've said, and more than happy to support in that and be a part of that process, because as I mentioned earlier in the meeting, the challenges that we're facing in Sandwell and the Black Country as a whole are unprecedented, and have only got greater because of COVID. So I think that's a very good plan moving forward.
Okay, well, maybe Councillor Boston, you might be keen enough to support it, to chair it, but maybe we can speak out of this meeting.
Let's talk offline, yeah.
Okay, Councillor Stephen-Simpkins.
I was just about to nominate Councillor Ahmed Boston. To be fair, I think it should be someone from Sandwell, as what Ahmed has just explained about the challenges that face not just Sandwell but the Black Country. But Lisa, Kathy's got the transport thing. I've got a different role within our authority, so it would be a bit of a conflict of interest for me to do. But I think Ahmed would be absolutely fantastic in the chair, to be fair. He's got some great skills. Yeah,
can I also be clear that clearly I did consider Councillor Angus Lee because we did have last year, I had a great experience of co-convening a task and finish on skills with Joe from Solihull. But again, because Angus Lee holds an executive cabinet position in Dudley, it'd be inappropriate for him to chair the task and finish. So I think, Ahmed, we're not saying you were the last choice, but you were the one where there was possibly the most objective.
No, well, I'll be more than happy, Chair, to chair the task and finish group if that helps. Yeah.
Okay, thank you. We'll come back to you after the meeting, Deborah.
Sure.
I think you're on mute now, Deb.
Beg your pardon, Chair. Just in terms of your forward plan, I find it a little bit odd that you haven't got the white paper for levelling up and devolution. So we're expecting that to be published possibly at the end of October, beginning of November. So I think it would be interesting, in inverted commas, for the Scrutiny Committee to look at that. And then you might also want to take the community priorities that we discussed earlier today and make that read across. If this is what the community are saying are really important to them for recovery, how is the combined authority in the region responding to those? And then one of the biggest challenges, I think, for this region post-COVID will be the impact of the lifting of furlough and the implications that has for potential redundancies. So again, in terms of scrutiny, you might want to look at the ways in which the combined authority is responding to that.
Could you tell me, you know, the devolution white paper we're expecting end of October, early November. Is it going to be a proper consultation, or is it going to be another one of these sort of announcements that we then find half the stuff's inactive before we blinked? Or, you know, will the reloaded question, I apologise.
I mean, I was just going to say who knows, but that sounds a bit flippant. So what we do know is that it will be put out for consultation. So as a region, we will want to respond to that. To that consultation.
If we were to say that we would want a full discussion in January on the where we would go with the governance review, having participated the paper through email with members and the devolution white paper, would we be in time, do you think, for any adequate response, or will that be too late?
I mean, the white paper was originally scheduled for early September. It looks like that slipped to the end of September. So I would recommend penciling it for early November, and then we can always defer back, and with the option to defer to January if the timetables continue to slip. The spending review will also be will be happening sometime in the autumn. So it might well be worth thinking about revisiting that in January.
Okay.
I mean, my view, Chair, is that this is so important. I don't think it would be unreasonable for you to call an extraordinary meeting to consider it, actually.
Okay. No, well, that makes me juggling agendas. Having actually got Mike to November's meeting, I'm loath to then suggest he doesn't come. Okay, let's see when the paper is held, and if members could bear in mind that we will actually have a specific meeting to look at the devolution white paper, and within that we will also pick up on some of the governance recommendations. And I do agree with the impact of furlough being built in. Clearly that is going to be massive here. And if we can, Lindsay, put the comprehensive spending review into January, I think that would be helpful. Because I presume I noticed, I didn't know if a page was missing earlier, and I was going to politely ask afterwards, because January and February just missed out of this.
Yes, so we would have to schedule a meeting in for January. In previous years, we had a Q&A on connectivity in February.
Yeah.
However, that's now gone over to the Transport Scrutiny Subcommittee, and they'll question the portfolio lead for transport in that respect.
Yeah.
So, yes, we can schedule a meeting in for January if that's what the committee wishes to do.
Yeah, yeah, that makes sense. Okay, if we can do that, Peter.
Okay.
Peter Fowler.
Yeah, Chair, thank you. Yes, again, listening to all the conversations, a number of things. Certainly welcome the reports on devolution and the community priorities, etc. All those, certainly support those. And I do welcome that bit about the task and finish group on the Black Country as well, because I do hear from members around the table saying that with respect that they don't get their fair share, and it'd be interesting to make sure to see how we try when we see that people do get their fair share across the West Midlands combined authority. The other thing that I'm still has me fidgeting in my seat is the fact Stephen actually brought it up some time ago, and that's about, Lisa, I've talked about us continuously not being quorate, and what effect is that having on us as a team, it not being quorate. My final bit is I did ask in the chat if we could have a copy of the Health Prevention Fund, and is there an in-depth report, this was to Sean, on the Grand Central Station, etc., that we talked about earlier. Thank you, Chair.
Thanks. I'm very intrigued as to why you're allowed chat and mine's disabled. Okay. You're safer than me. Okay. Can we ensure that Peter gets those documents? What is the picture behind you, Peter? I've been trying to work it out all meeting. No. Okay. It's like Hansel and Gretel. He's on mute. Forget it, Peter, you're on mute.
It just looks a bit like old Stratford upon Avon, being the Warwickshire bag.
Okay, very lovely. Okay, my sense is that brings us to the end of the meeting, and it's 12:07, so we've overrun by 7 minutes. My